Hi, I'm Dr. Kelly Robazza and welcome to Beaches Health Group. I'd like to discuss today a little bit about frozen shoulder and just the immense epidemic of cases of frozen shoulder that are existing out there in the world. A lot of the present treatment is directed solely at the shoulder itself, and most of the research that's coming out now is directing us toward a postural condition and actually a spinal misalignment problem. Some of the latest research shows that we're looking at a postural problem and a spinal misalignment issue. That's trapping the spinal accessory nerve that can create a tethering effect into the shoulder joint itself. So here's a couple things to look for if you're suspecting someone has a frozen shoulder or if you know someone already does. We're looking at a head position, malposition of the head onto the neck. So a lateral bending head and a rotation of the head on the neck. This really traps the spinal accessory nerve that's trying to exit from that area. If the patient's stuck like that, oftentimes for chronic positions, they'll turn their eyes to the horizon so that they have a levelness across their eyes, and you really do see a change in the shoulder position, creating a lot of stress on the rotator cuff and ultimately the upper back. So really the difference between a type 1 and a type 2 frozen shoulder is in the type 1, you're really dealing with an acute irritation to the nerve, and correcting that spinal alignment and the posture of the patient will quickly resolve the frozen shoulder syndrome. If the person's allowed to have more chronicity, or if the frozen shoulder is allowed to create structural adhesions and physical scar tissue, the type 2 is a lot longer treatment case where you're still needing to correct the spinal alignment, but also you're going to need to do your necessary soft tissue treatment on the frozen shoulder itself. You'll have pain in the shoulder and limited range of motion, but releasing the neck will get you a full range of motion back very quickly. If it's a type 2, it just means that the condition's allowed to really settle in and create structural adhesions in the rotator cuff and the capsule of the shoulder itself. So you'll need the spinal alignment, of course, to release the nerve, but more time needs to be spent in the type 2 on releasing the adhesions in the shoulder itself. So it's just a little bit about how we get successful treatment of a frozen shoulder here at Beaches Health Group. I'm Dr. Kelly Robazza.